Hi everyone, my name is Miriam Abadi and I'm your host for Marie Claire's Beauty Podcast. Today we have a very special guest and we're going to discuss something super exciting, which is skin, specifically skin reset. So welcome Dr. Samar.
Thank you for having me.
And we're so happy to have you with us today. So you obtained your medical degree from the American University of Beirut. You're a general and cosmetic dermatologist, but you also went to Brazil, which is super exciting. And you have so much knowledge to share. So I'm going to dive right into it. We are going to discuss skin reset with all the New Year's resolutions. Maybe it's related to that. I'm not very sure. What does it really mean?
So to put it simply, skin reset is basically like a skin detox. So sometimes for different reasons, our skin may act up. We could suddenly have a flare of acne, severe dryness, severe redness or rosacea. And this could be related to factors that we are aware of, and sometimes we don't know what caused this. So basically, skin reset is treating your skin through this period. And a common mistake that patients make is they are too aggressive. They want to get rid of this problem, so they are too aggressive, and then they end up with another problem. So it's very important to be patient and have a simple yet targeted routine.
Okay, so now we understand that it has nothing to do with New Year's resolution. I wanted to discuss something like a skin breakout, which is like, for me, an epic skin meltdown. What do we do?
So first, we have to identify the triggers. Okay. So for acne, a very, very common trigger is stress. Really, we should not underestimate the effect of stress on skin, on general health. So we have to manage stress. I know it's easier said than done, but I don't know, Miriam, how do you deal with stress usually?
I just meditate. I meditate twice a day. I try to, take some time for myself, but it's inevitable. You're absolutely right.
Yeah, so that's one way, meditation. Yeah. Exercise is for me like the way to go. And I mean, you have to find things that help you really reduce the stress levels. Another trigger is diet. So some foods have been shown to worsen acne. A very common factor is dairy products, especially cow's milk. Foods which increase your blood sugar. So we call them foods with a high glycemic index. Not only sweets, but also carbs like rice, pasta, soft drinks, and whey protein. So we have to try to avoid these. Okay. Another factor which is very common is that the patient might be using skincare products which are not suitable for the skin type. No, I don't think so.
I was trying a million one products and then I'll get like all over the place.
Yeah, so if you have acne prone skin, you don't want to use too many layers, and you don't want to use creams that are too thick because this can clog your pores and worsen the acne. So when it comes to treatment of acne, most acne agents are a bit irritating. So you have to start it slow and build it up. And depending on the type of acne, we choose the right agents. It could be a vitamin A derivative, exfoliants like alpha hydroxy acid, salicylic acid, benzoyl peroxide. It depends on the case. So of course, visit your dermatologist.
Definitely. And what about, relating to the weather right now? I mean, I have mixed skin, but what if I get I get sometimes very dry and scaly skin. So what should we do with skin resetting?
Yes, so basically dry skin is very common in the winter because of the low humidity, the harsh winds, the harsh weather conditions basically. So one product which may have been working perfectly for you in the summer may all of a sudden cause irritation and dry patches. So you might have to change your skincare routine in the winter. Another thing is sometimes a mistake that people make is over exfoliation. So you have to, for me, for example, using gentle chemical exfoliants is better than going for harsh mechanical exfoliation. And finally, another thing is that patients sometimes don't moisturize. A lot of patients actually don't moisturize their skin. So moisturizing your skin is a must, and the best timing is actually after the shower.
After the shower, especially if you have oily skin. Like I used to not moisturize, but it's so important to get this plumpy, healthy looking skin. And moisturizing is so important. So
even if you have oily skin, you have to moisturize, but it has to be suitable for acne-prone skin.
100%. So I heard that a skin reset takes around 27 days.
So in general, so basically the skin regenerates itself, basically, which means that new cells form and the outermost cells are shed. This whole cycle takes around 28 days. And sometimes we need even a longer period of time to see results. So I always tell my acne patients, my rosacea patients, you have to be patient. Patients need to be patient. It takes time. It takes several weeks. You have to be compliant and you have to continue with the treatment.
You have to be consistent as well. I think this is, people lose their, patience about, like, after 1 week, but we just have to, like a skin is like a consistent, you have to keep your consistent routine.
It's constant work.
It's constant work, yeah. Now to the more juicier stuff. What skincare trends need to stop?
Okay, so for me, the first thing is the million-step skincare routine.
Yeah.
The more you complicate it, the less likely patients will be compliant, and the more likely you will need a skin reset because your skin will act out. Another thing for me is, and some people might disagree, but it's the whole clean beauty marketing. So basically everything in life is a chemical. Water is a chemical, and chemicals are not the enemy. So, and sometimes if you use agents in their natural state, it can actually harm your skin. So for example, if you put lime or lemon juice on your skin and then you expose it to the sun, you could develop a severe skin reaction called phytophotodermatitis that can look like a burn. So sometimes modifying natural ingredients or even creating them in a lab is safer and better. Not everything is black and white, and always look for the evidence behind any claim.
Absolutely. I so agree with you. This is another topic that we should tackle. But for 2023, we're just starting the year. What do you think we should jump on?
So one thing which has already started and I'm very happy about is skin checkups. I'm getting recently, I don't know why, over the last few months, a lot of patients who are coming for a skin checkup, in which basically a dermatologist examines your skin from head to toe, checks your moles, checks your lesions, and if there's any lesion of concern, we basically take a sample called a skin biopsy, we send it to the lab, and they examine if it's cancerous or not. So I hope this becomes a trend, especially in the Middle East. I don't feel there's enough education about this.
Yeah, I think that's a very good point. But let's talk about procedures, because I go to my dermatologist twice a year, when seasons change. But what is like the most requested procedure that you had in the past year, let's say?
So nowadays, what I like is that people are focusing more on prevention. So that's why we're getting a lot of people in their 30s or 40s who are coming for collagen stimulating and tightening procedures. You can do this using devices like HIFU, high intensity focused ultrasound, the microneedling, radiofrequency, which is really popular now.
Morpheus.
Exactly.
Yeah, it hurts like
yeah, but you have to apply the anesthesia for at least 40 minutes.
Yeah, exactly.
Another thing we can use to stimulate collagen and tighten are the injectables like poly-L-lactic acid, which is known as Sculptra, the calcium hydroxyapatite, which is Radiesse. So these are really popular nowadays.
Okay. Do you think these trends will continue into the 2023?
For sure, because we're really seeing amazing results.
Yeah.
So
perfect. Talking about anti-aging, prevention. People don't like the word anti-aging, but what is for you the best prevention routine, let's say, that you would recommend?
So number one, sunscreen. Sunscreen is the best product you can use. I like to use vitamin C in the morning, which is an excellent antioxidant. It helps with pigmentation. And for the night, my favorite ingredient is vitamin A derivatives, like retinol, for example.
So for retinols, let me just ask you this question. What dose do you recommend that anyone should start with?
So you always want to start slow and build it up. So with vitamin A derivatives, you have retinol, which is the more gentle one. You have tretinoin, which is the most aggressive one. So I would like for patients to start with retinol, especially when we're dealing with anti-aging. So you start with a low percentage, like 0.1, 0.3, and then you build it up. Once you tolerate the high percentages, you can try your luck with tretinoin.
And it's also, what I understood is that also it's like the quantity. You cannot use
pea-sized amount.
Yes.
Don't overdo it, or else you'll end up with a very irritated, dry skin.
And you need to reset.
Exactly.
Okay. So for lifestyle, everyone now is approaching beauty with a more holistic approach. So what is, in your opinion, in terms of lifestyle, what really helps your skin glowing and be healthy.
Yeah, so we already mentioned stress and stress reduction.
Mm-hmm.
Diet is also very important. Other factors which may lead to premature skin aging are excessive sun exposure. So please don't tan, don't do solarium, which is very bad. Reduce or stop smoking, and of course try to get some good sleep.
Yeah. And I think exercise is something that you also
for sure.
Yeah, because it stimulates the whole circulation and all these things, and even for your mind, you feel much better afterwards. Okay, I mean, I could talk to you for so much longer. Thank you so much for your time.
Thank you for having me.
And we'll catch up another time very soon.
Sure.
Thank you so much.
Thank you.